we have the potential to heal anything. Right now, our bodies are healing cancer cells, are healing heart disease, diabetes, whatever the case may be, whatever the disease may be, we have the perfect medicine cabinet right inside our body. Now, if you look at that, you think that, okay, we can live to our God-given health potential, but let's even go into that deeper. Where does that true health and healing come from? So think about this just for a second. We start off, in the very beginning, sperm and an egg. Then 2 cells, 4 cells, 8 cells, 16 cells, 32 cells, keep dividing, 64 cells, 128 cells, on and on and on, and then 9 months later, we have 70 trillion cells. You know how much a trillion is? Just to put this in perspective, if I were to count to a trillion by 1001, 1002, just in 1 second increments, it would take me 32,000 years to get to 1 trillion.
My goodness.
I didn't believe that when I first read that. So then I have my calculator at my office, I'm figuring this out, and it's like 32,900 years. So 32,000 years to reach 1 trillion counted by 1 second intervals. We have 70 trillion cells in our body. So from 2 cells to 70 trillion cells 9 months later. And this is something that's out of our really human, mind to even understand. And in my opinion, I know it's yours as well, that's a miracle of birth and life that's happening. And think about this as well, that at 9 months, it's just not a clump of cells. It's organized tissue. It's healing. It's a heart that's beating. It's a liver that's working. It's lungs that are breathing, a brain that's thinking, eyes that are blinking, and so forth. So it's organized tissue that has life in it. So there's an amazing healing power inside of our body. And it starts at conception. It doesn't start at 2 weeks or 4 weeks. It starts at conception, the second one. And then at 9 months, we're born, but that healing power stays inside of us, hopefully for 90 plus more years. So just to lay the foundation here, we have an amazing healing power inside our body. Now, our body is designed to go towards health. No matter who you are, it's not, one of my favorite sayings is God doesn't make junk. So God does not make junk. It's not that he was saying, okay, well, John, you get 50% health, Betty, you get 10% health, Bill, your lucky day, you get 100%. God's 100%. It's not 10, 50, and 10, or it's not proportionate like that. So we have 100% health inside of you, and inside of us, and our bodies are designed to go in this direction. But the thing is, where do most people's health, which direction does it usually go in our society? Down. And I ask that question to a lot of my patients to say, well, is that a normal thing or is that an abnormal thing? Is it normal to go in this direction or is that abnormal to go in that direction? What do you think? Abnormal. And it is. A lot of people say, well, that's just that's what's supposed to happen. Heart disease and cancer, it's in my family, so that's going to be me. That's not true. It's very abnormal. And to really clarify it more, it's common. It's so common that it becomes the norm for health to go in this direction. So at 20, it's a medication. At 30, it's a few more medications. Heart disease, cancer. At 50, the wheels start to fall off. And it's around us so much that's become so common that that's the norm. But we have to realize in these patients and people that come in to see me, that's very abnormal to happen. So health should go in this direction because that's the way our body is designed. Now, I just have rose-colored glasses on, I think, okay, we live forever. No, we don't do that. But as far as health continuing to go up and up and up, that's the way that our body is designed to work. If I cut my finger, what should happen?
It's going to bleed.
It's going to bleed. Then what? It's going to heal. So you got to write your point. So it's going to bleed. It's going to stop bleeding. It's going to scab over. It's going to scar over, and it's done.
Right.
Did I have to think about that? Did I have to say, okay, start bleeding, flush out the bacteria. Okay, stop bleeding. Okay, form a scab. I don't have to consciously think about that. That's how amazing that the body is designed to heal. That there is no difference between healing a simple cut on my finger, on our finger, versus healing an ulcer on my stomach, healing cancer cells on the liver. There is no difference between the two. It's the same principle as far as how the body is designed. So, hopefully you're with me that our body is designed to go in this direction. God didn't make junk. So the question comes in where, why do people get sick then? If our body's so smart, if it's so intelligent, Dr. Jackson, why do people get cancer and heart disease and so forth? And it's not because of lack of health inside the body. The reason is that there's interference with the expression of that health potential. So it's not because you have 90% or 80% health inside the body, it's that the health is being interfered with. And there's 5 main factors that we have to focus on to make sure it's not being interfered with. So if you can understand this tonight, I can promise you your health will change. I can promise you that. It's an absolute, it's a law. People in Japan, when they become, the way of our world here in Western civilization, heart disease, cancer, stress, modern Westernization of them. And there's a book, it's called the Okinawan Project. And what they did was they went and studied the people in Okinawa, Japan. They said, okay, there's more centenarians or people who live to be over 100 in Okinawa than any other place on the planet.
Right.
So doctors went over there and they studied this group of people and said, what's so different about these people? It's genetics. So they're superior genetically to us. That's what they were thinking, right?
Right.
So they looked at their genetics and they still had high-risk cancer genes. They still had osteoporosis genes. They still had the same risk heart disease genes that we do. We're like, well, that's sort of confusing. So it's not genetics. So genetics are a tendency. They're not the rule. So obviously we take traits from our parents, but it's a tendency. What do you think the rule is? Yeah, so our lifestyle. And the thing is that we don't really have control to an extent of genetics, but we have control over our lifestyle. And lifestyle, when we start to improve lifestyle and remove these 5 levels of interference that I'm going to go over, then health has to go up. Again, it's an absolute. It has to go up because that's where everybody's designed to go. So, interference. Number 1 is neurological. And this one is what I call the missing link because most people do not know this and they don't understand it. The other 4 are pretty much common sense that you've heard before. So neurological, what that means is when I say the body has an amazing healing power inside of it, it starts right here in our brain. So right now, our brain is controlling how fast our heart is beating, how our lungs are breathing. For us to blink our eyes, for me to move my arm, the brain is controlling all of that. For me to heal that cut on my finger, the brain is controlling that. To heal the cancer on the liver, the brain is controlling that. You have to ask yourself, okay, well, how does it do that? It doesn't do it by mental telepathy where it just sends out messages. It has to have a hardwired connection. And that hardwired connection is through the spinal cord and how all of these spinal nerves that come out, and there's a nerve that goes directly into my heart and is telling the heart what to do. So the brain has a connection. It's just like a computer that's talking to the printer and the fax machine and whatever the case may be. It's telling it how to work. And it's a two-way street. The heart's telling the brain, okay, I'm doing this and I need a little bit more help, so I need more supply. And the thing is that this is the only system, meaning our neurological system, that is totally encased in bone. So we have this protective helmet, and then we have a spine or a backbone that protects that lifeline, our spinal cord and all those nerves. So this is why, when I'm talking about posture on the radio, it's just not cosmetic. This is just not a cosmetic problem. That's a health problem because it's affecting how the brain is communicating down and out. So from a spinal standpoint, our backbone, there's 24 bones from top to bottom. When they're in proper alignment, there's no pressure on the nerves of the spinal cord. That's what we want. That's the way we're designed. However, when we have life, and life is 1,000,001 different things, from sitting at a computer to sleeping wrong to crashing on a bike when we're 3, 10, and 30 to being born and learning how to walk to bending over patients all day, who knows what. All in our weekend warrior things, we all do these things. We abuse our spine every single day. What happens is that because of that abuse, the spine eventually shifts out of position and changes us, changes our structure. But here's the key. Where that interference comes in is now it starts to put pressure on the nerve. Now, that amazing healing power we're talking about is not going to get to the heart at 100%. Or the lungs, or the muscle in my hand, whatever the case may be. The tricky part about this is when this happens, we don't feel it. We eventually will. There will be pain when we're 25 or 35 or 50 or 60, whatever the case may be for you individually, but when it initially starts, most of the time we do not feel it. And that's true for almost any chronic disease or condition. Let's think about this. When do you feel heart disease? Let me ask it a different way. What's the first symptom, and over 70% of the time, over 70% of the time, the first symptom of heart disease?
Chest pain, heart attack.
Heart attack. You're right on it. So it's a full-fledged heart attack. My father, unfortunately, is a perfect example of this. He had a ranch in Oklahoma, farmer, rancher, cows, tractor, hay, men and fencing, the whole 9 yards. He went in for a routine physical. I said, well, you're getting to be in your 70s, let's do an EKG. Like, well, that's a little bit suspicious, let's do an angiogram. You've got 4 blocked arteries, more than 90%. What? So I'm going up there, taking him to the hospital in Tulsa. He gets in my truck, and he starts thinking, he says, there's nothing wrong with me. I can't believe I'm getting ready to have my chest sawed open, my heart stopped, veins harvested from my leg, put into my heart, and all this big invasive procedure done. He said, I feel fine. I don't have any chest pain. I don't have any arm pain. I don't have any shortness of breath. Then he starts thinking, they've got my records, that crazy hospital's got my records mixed up with somebody else. This cannot be me. It was him. He could have died from a heart attack on the way to the hospital. He didn't feel anything. And that's over 70% of the time. When does a person feel cancer? Early or late stages? Late. When do you feel diabetes? Early or late? Late. When do you feel osteoporosis? Maybe never. When you fall down and break a bone. Stroke. When do you feel a stroke? Early. Every disease and condition, we feel it way down here. So health, when you think of health, it's one of our most important assets that we have. If we don't have our health, just like you said, staying spiritually connected, and our mission here to honor our temple, our health is very, very important. I mean, it's at the top. And if we don't have our health as far as providing for our families, fulfilling our mission, to doing what we're called to do, suffers. Everything suffers if we don't have our health. So now, we have one of our most important assets, and most people determine their level of health by how they what? By how they what? By how we feel. It's a human nature thing. So we have our most important asset that we're determining by solely how we feel. When I wake up in the morning, no pain, I feel good, no symptoms. I have symptoms, so we're determining our health that way. But then I just went over, by the time we feel something, it's been going on. It's too late. It's been going on many, many years. So as far as, don't determine your level of health by solely how you feel. It's one of the biggest mistakes that I see. It's just the same thing back to the neurological system. When the spine shifts, when it puts pressure on the nerves, interfering with that message from above, down, and inside out, that's interference. Most of the time, we do not feel that initially. That's why it's important from a spinal standpoint to get it checked. So I preach to my patients. Dentists have done a great job. They have educated the public to get their teeth checked from going to schools and telling kids to brush their teeth. Think about dentistry 50, 60 years ago. When did people go to a dentist 50, 60 years ago? And when they had a toothache, they didn't go there and say, well, I'm brushing my teeth twice a day, I'm flossing once a day, I see the dentist once every 6 months. That didn't happen. Dentists have done a very good job of educating the public. Chiropractors have done a pretty bad job of educating the public on how to take care of the spine. So it's important to make sure you're doing things proactively so they don't get into that symptomatic or waiting for the pain to start to occur. I did that as well. Permanently damaged my spine and made a big mistake, but then God put me through that. That's the right way to put it, but I went through those trials and tribulations for a reason, put me in the place I am. So that's number one, neurological interference. I hope you have an idea just of what that is. It's basically an interference between the way the brain communicates with the rest of the body, and a healthy spine has to happen in order for that to happen 100%. Number two is nutrition. So some basic rules on nutrition. So again, what we're going over is interference, 5 levels of interference that get in the way of our body expressing health the way that it was designed to. Again, you know how to be healthy. We don't have to, and I tell my patients this every single day, I can't put more health inside of you. That's way above my pay grade. I can't do that. You already have 100% there. Well, doctor, why am I so sick then? It's because there's interference and your body's not expressing that health to its full potential. So that's the key. I've never healed anybody. If you're going to a doctor and says they healed you or put more health inside of you, I'd recommend you go somewhere else. Flat out. I mean, they're taking way too much credit. Your body knows how to heal. It's hard. We have a perfect design already. We don't have to reinvent the wheel. So, number 2 is nutrition. Basic rule on nutrition is food by God, food by man. Y'all already probably know what I'm talking about.
Right.
Nutrition is common sense, really. So, apple, Twinkie.
Right.
So, food by God again, things that were put on this earth for our consumption. What that means is, to put it really simply, if you see it advertised on TV, it's not going to be a food by God, it's going to be a food by man. So, food by man are things that have been touched more by man's hand. Meaning they've been processed, colored, sweetened, fat taken out, partially hydrogenated, whatever the case may be, colored, preserved, those are all food by man. So now from a practical standpoint, can we eat 100% food by God? And really the answer to that in this day and age is no, unless you're really going to the extreme. So we have to be practical about it. And what my rule is, you can either be an 80-20, or you can be 90-10. So as far as goals, looking at when you're going in the grocery store and you're at the checkout line, you're looking in your cart and say, well, I have 80% of this. Is this food by God? God intend for me to consume this. Is this going to feed and fuel and heal my body? Or is it mostly food by man? A bunch of processed foods, packaged foods, salted foods, and these different types of things. So that's really nutrition 101 there, of having that practical common sense of eating more food compared to food-like substances. So again, food by God and food by man. So I'll answer some questions if you have some at the end more about nutrition, because I know that you're really interested in that, but I really can't put it any more simply than that. But here's the thing, why do we still choose? Why do we still have a desire to go towards this? And one, it can be an addiction. Interesting, I was really listening to what you all were saying as far as, because I didn't know really what I was going to talk about. And you said, well, whatever God's going to talk about, we can do that. That'd be a good idea. So I'm like, okay, that sounds good. So when you said, well, I started eating potato chips with Oreo cookies, and I can't stop. They're gone. And that's not necessarily our fault. It's not necessarily a willpower issue. Part of it is, but there's also an addiction issue in there as well. So an addiction is, when you look at sugar and processed food, it's highly, highly addictive. Sugar is more addictive than cocaine. And that's a serious drug. So they look at what happens when we have sugar. Is it works on what's called the opiate receptors in our brain. So this is the pleasure center of our brain. It starts producing good, feel-good types of chemicals in our brain. So when we have that sugar, most people are sugar addicts. If you're a sugar addict, is when you have that Snicker bar and it's just like, yes. It's just like, that's what I needed right there.
You're doing one of my Reese's Cup commercials right now.
Reese's Cup. We all have our Reese's Cup, we all have our Snickers bar, whatever the case may be, but most people are a sugar addict. And that is our brain, it puts a craving into your body and into your brain that if it's in the house, it's going to get eaten. There is no more willpower. Maybe you can hold out for maybe a couple hours, but it's going to be eaten if it's in the house, right? So to get over that addiction, it's very, very difficult. We do a lot of nutritional counseling, and as far as getting people off wheat to changing dairy and things like that, but the hardest one by far is sugar, because it's so addictive to our brain. So when somebody is coming off of sugar, guess what they're going to have? Just like a drug addict or an alcoholic, they're going to have withdrawals. It's going to be the shakes, the sweats, the headache, the brain fog, the whole 9 yards, due to those withdrawal types of symptoms and withdrawing from the sugar. So if you're having a hard time with sugar, you're not alone. It's not just a willpower, but it is an addictive thing. Now, I'm not saying you have to go to Sugar's Anonymous or anything like that to get over that, but there are different tasks or different strategies, I should say, to get over that sugar addiction. But it's very, very hard. I've been a sugar addict. I mean, as far as give me some Snicker bars and things like that, I'm good. But then you start to think about it, and it got to the point where and this is where it changed me, when somebody, the mentor told me about this, it's like, okay, we know the apple's good, the Twinkie's bad, then why do people still do that? And it's really, the one way I identify with it is it's the big, our why isn't big enough. What I mean by that is your why isn't big enough is once you know your big why, the how is easy. So you have to ask them, okay, what is the big why? What's he talking about? What is our big why? Why do I want to change? Why do I want to improve from a health standpoint?